You've probably checked your pulse before, right? Just to see how fast your heart's beating. But what if I told you there's a whole complex language hidden in that simple beat? Well, today, we're going to learn how to read it, to actually understand the incredible stories your pulse can tell about your heart.
Believe it or not, your own fingertips can be one of the most powerful diagnostic tools out there. Seriously. With the right technique, you can feel the signature of a leaky heart valve, figure out how strong the heart muscle is, and even get clues about some really serious conditions. Your pulse is just packed with data, and we're about to learn how to decode it.
Okay, so here's a little mind bender for you. The blood itself, it's actually moving pretty slow, like less than a meter per second. But the pulse, that pressure wave sent out by the heart, is insanely fast. We're talking up to 20 times faster. The best way to think about it is this. The blood is the water in the river, but the pulse is the speedy pressure wave traveling on top of it. It's the message, and it gets delivered in a flash. All right, so here's our game plan for this explainer. We'll start with the fundamentals, what a pulse actually is. Then we'll get hands-on with the proper technique. After that, we'll cover the basics of rate and rhythm before diving into the really cool stuff, volume and character. And finally, we'll put it all together and see how these patterns tell a clinical story. So, let's kick things off with the most fundamental question of all. When you take a pulse, what is it that you're actually feeling? Here's the key thing to wrap your head around. You are feeling a pressure wave. You're not feeling blood just flowing by. What you feel is the artery wall expanding and snapping back as that wave of pressure generated by your heart shoots through it. It's almost like feeling the shock wave from a drum beat. It gives you this direct, beat-by-beat signal of how your heart is performing.
Now, to read that signal accurately, you've got to do it right. And that means your technique is absolutely everything. So let's break down how to do this like a pro.
Now, you can find a pulse in a bunch of places, but clinicians definitely have their favorites. The radial artery, right there at your wrist, is the go-to for a quick check of rate and rhythm. But if you want to analyze the pulse's shape and strength, its character, the carotid artery in the neck is the best spot. Why? Because it's so close to the heart, it gives you the cleanest, strongest signal.
The gold standard is the three-finger method. By using the pads of your index, middle, and ring fingers, you get a much better sense of the pulse wave as it travels underneath. And here's the #1 rule. Never, ever use your thumb. Your thumb has its own strong pulse, and you'll just end up reading yourself, which isn't very helpful. Okay, our fingers are in position. Let's start the actual assessment. The first two pieces of the puzzle are the most basic, but they're super important. Rate and rhythm. How fast and how steady.
So, what's normal? Well, for most adults who are just resting, the sweet spot is somewhere between 60 and 100 beats per minute. Think of that as our baseline. Anything higher or lower tells us that something else might be going on. If your heart rate is cruising above 100, that's called tachycardia. It could be from something obvious like a fever or underlying issues like anemia or an overactive thyroid. On the flip side, if it's below 60, that's bradycardia. Now, for a serious athlete, that's totally normal, but it could also be a clue for an underactive thyroid or the effect of certain heart medications.
Okay, check this out. This is a fantastic clinical pearl because it shows just how interconnected our vital signs are. The rule of thumb is, for every single degree Fahrenheit your body temperature goes up, your heart rate should speed up by about 10 beats per minute. This is such a powerful clue. If a patient has a really high fever, but their pulse is just plodding along, that mismatch is a huge red flag for a clinician that something unusual is happening.
All right, so that's rate. Now for rhythm. A healthy pulse is rock steady, like a metronome. But if you feel a rhythm that is just complete chaos with absolutely no pattern to it, that is the classic textbook sign of atrial fibrillation, or AFib. It's an incredibly common arrhythmia, and being able to feel it is a huge first step in diagnosing it.
So we've got rate and rhythm down. Now we're moving into the more advanced material, the really subtle stuff that reveals so much. We're talking about the volume and character, the actual shape and feel of the pulse wave. This is where the real art comes in.
First up, the water hammer pulse. And trust me, it feels exactly as dramatic as it sounds. It's this powerful, bounding beat that shoots up and then just collapses, totally vanishes. This happens when the aortic valve is leaky. The heart pumps blood out with a ton of force, but then some of it immediately falls back into the heart, causing that sudden drop in pressure.
Now for the complete opposite, we've got pulsus parvus et tardus. I know, it's a mouthful of Latin, but it literally tells you everything you need to know. Parvus means small or weak, and tardus means late or slow. So it's a weak, slow-rising pulse. it feels like it's struggling to reach its peak, which makes sense because it's the classic sign of a stiff, narrowed aortic valve that the heart is fighting to pump blood through.
Okay, this next one is subtle, but it is an incredibly serious sign. The rhythm is perfectly regular. Tick, tock, tick, tock. But the strength of the beat is changing. You feel strong beat, weak beat, strong beat, weak beat. This pattern is called pulsus alternans, and it's a sign that the heart's main pumping chamber is in serious trouble.
Don't let the name fool you. Pulsus paradoxes sound strange, but there's no paradox here. It's a very real and very dangerous sign. What you feel is that the pulse becomes noticeably weaker or even disappears every single time the person breathes in. A tiny drop is normal for all of us, but a big, obvious one can signal a life-threatening emergency, like cardiac tamponade, where fluid is squeezing the heart.
So we've gathered all these individual clues: the rate, the rhythm, the volume, the character. Now for the really cool part. In this final section, we're going to put it all together and see the clinical stories these pulse patterns tell. You can think of this as your diagnostic cheat sheet. It helps you connect the dots. So let's try it. If you feel that weak, slow-rising pulse, that pulsus parvis et tardis, your brain should immediately think aortic stenosis. You feel that totally chaotic, irregular rhythm, you're almost certainly dealing with atrial fibrillation. See? Each pattern is a major lead in the diagnostic story.
And get this, it's not always about feeling just one pulse. A really slick clinical move is to compare two pulses at the same time. If you feel the radial pulse in the wrist and the femoral pulse down in the groin, they should hit at almost the exact same moment. But if the pulse in the leg is late, that radiofemoral delay is a huge clue that there's a blockage somewhere in between, like a narrowing of the aorta.
And for our final pearl, and this is a big one, you're not just feeling the wave, you're feeling the vessel it's traveling through. As you gently press, pay attention to the artery wall itself. If it feels hard, rigid, like a cord, some people describe it as a pipe stem, that's a direct tactile sign of atherosclerosis, or hardening of the arteries. You can literally feel it with your fingertips. And that quote really just says it all, doesn't it? In our world of high-tech scans and incredible machines, the simple, skilled act of just feeling a pulse is still a fundamental, powerful, and absolutely essential diagnostic tool. So the next time you check a pulse, remember to listen closely. What story is it trying to tell you?